What is a recovery program? This is a complicated question, and to start off, it's important to say that recovery and rehab are not synonymous. Rehab is only a part of recovery. So recovery involves many things. At the start, it can include abstinence, so stopping taking the substance of choice. But in other schools of thought, there's harm reduction. And some people just, despite many attempts to try to abstain, they end up failing and having a relapse. And in some situations like this, then something called harm reduction is more helpful. And what harm reduction schools teach is that if a person is going to use, to try to minimize the amount of damage they cause to themselves. So this involves moderation of their drug of choice to make sure that the drug of choice is safe and is consumed in a safe manner. Regardless, either school of thought, whether it's total abstinence versus harm reduction, recovery is the same. So this is multifactorial. There's many things. So abstinence is one, or reducing intake. That's the first part of recovery. The next most important part is for a person to open up, for the user to be open and honest and share what's going on inside their mind. Addiction is an illness where a person is isolated and alone, and they tend to internalize or stuff their feelings and not talk about it. So it's an illness of isolation, whereas recovery is all about connection. So this part, to connect with others, it's important to be honest, to take ownership, it feels good to share some of the most shameful things. A lot of people who are substance users end up hiding a lot. That's just a normal part of substance abuse. There's lots of lies, deception, manipulation, and it's important for others to realize this is a part of the illness. Instead of judging them, vilifying them, to understand that this is a normal part, this manipulation and the shame associated with it, the embarrassment. This person is doing this because they're embarrassed and shamed, so they don't want to other people to know. But in order to recover, it needs to be the opposite. The user, in order to reap the benefits of a good quality recovery, needs to fess up. And it feels good. I can speak from my own personal experience, that by sharing my feelings, sharing the dirty, dark secrets, the shame, the stigma, the things that I did that I thought were bad, when I share that in a safe environment, like with a room full of, or a small group full of other users, and they can lock onto that and they say, yeah, I did the same thing, and they smile and they nod and they forgive me. That is super important. So that's a big part of recovery, is to grab the bull by the horns, to be honest and open and candid, and to share the hurtful things. Connection with others, as I said, is an important part of recovery. And so it's not just being open and honest, it's also listening better. So mindfulness, being aware of what other people are saying, actively listening to somebody. This is an important part of showing empathy. It's listening to them and trying to put myself in their place, because for them it helps them knowing that they're not alone. That's the powerful part about empathy. So mindfulness is to be aware of other people, is to be aware of my surroundings, and it's also to be aware of my own thoughts. So this is where we call cognitive therapy, or when it's my own actions, and it's cognitive behavioral therapy. And that's important when it comes to decision making. So part of my own recovery was learning how to recognize the poor decisions I was making during my active addiction, that I would take out stresses on myself, unresolved conflict, arguments with my wife or my family, unresolved conflicts at work. I would internalize it, not talk about it with anybody, and just medicate myself to avoid feeling it. And that is a very common theme amongst other substance users. So in that vein, it's important to speak out about it, to let people know what it is that I'm going through in my life. What are those stresses? So this is where a 12-step group or a small group session really can help, by expressing what am I experiencing, what are the stresses, identifying things in my past that may be contributing to this self-loathing and self-destructive behavior, and to minimize this in the future. So the next important part about recovery is recognizing when I'm making bad choices. So I get derailed if I was to relapse. That's a clear, easy one. There are many times I've had cravings. They get better with time. But with the craving, it became important to realize if I continue to pursue this and glamorizing it and glorifying it and playing with it in my mind, that it's probably going to lead to a relapse. I learned to recognize when these happen all the time, to control them and just realize they're momentary, they will get better. And now, first they would last a few minutes, now they're maybe seconds. It takes a lot of practice. But my life gets derailed if I make poor decisions. So I need to listen to my conscience. My conscience knows best. During my active addiction, I didn't pay attention and I hated myself. I couldn't look at myself in the mirror. Self-loathing. And I don't want to feel that way about myself. I don't want to do anything that makes me feel bad about myself. So making good decisions by practicing good judgment, thinking ahead, playing the tape out is another expression, a tool that's used in rehab. And what that means is, if I am going to use, what's going to happen? And I've learned from experience several times by relapse that if I was to relapse, there's going to be a whole host of factors and anxiety and stress that I'm going to create for myself. And I don't want to live my life that way. I don't want to create more stress for myself. And it took me a few goes to realize that is what's going to happen. If I play the tape out, the end point is I'm going to feel like crap about myself. I'm going to start lying and deceiving others. I don't want to do that. I don't want to feel bad about myself. My recovery is a strong foundation. I build that up by paying attention to what I think is right, practicing self-discipline, and listening to my conscience. Recovery also involves balancing life with the things that I once liked. In the depths of my addiction, I tended to do this, and a lot of other people tended to isolate themselves from the things that they once loved. So recreational activities. For me, it's playing ice hockey, golf, tennis, hobbies. And so I lost those things. So in recovery, it's about finding those things. Playing ping pong. I did that, tons of that in rehab. And so it's important to have a balance in life, to have some recreation, have some entertainment, have some fun. At first it's difficult to think, well, how can I have fun if I'm not using my drug of choice or alcohol? But I can promise you it gets easier, and there's many ways to have fun without relying on drugs or alcohol. I promise you that. And in fact, I am more present. I in fact feel the joy and the enthusiasm and the laughter a lot more now, and when I'm clean. I don't need any substance to feel, to aid my way to enjoy like a camping trip. Everything feels better. Being connected with others is important. Volunteer work helps. A 12-step program teaches to help others who are going through the early stages of recovery, to reach out to them, let them know that there's help out there. That's an excellent thing to do. Other things that I do to help cope with the stress is, like I said, talking about it. I could have one-on-ones with a therapist. I continue with a 12-step group or other recovery groups like Rational Recovery or Smart Recovery. But basically the idea is to be connected with others, get involved in the community. And finally, as well, is to deal with my stresses by talking about it, by journaling. Meditation helps when I can't sleep at night and then my mind tends to be racing. I've gotten better at that as I've gotten older by meditating, just thinking about a geometric object, for example, and not allowing myself to get distracted. And every time I find myself racing again and thinking, ruminating, think about the same things over and over again and how I could have done things differently, I've discovered to recognize that and get back to that geometric object and to focus myself. It's a very challenging thing. Try practicing. Try thinking of nothing for longer than 10 seconds and see how that goes. So meditation is about thinking about nothing as best as you can for longer, and this helps facilitate falling asleep. In summary, what is recovery? It's not the same thing. Rehab is part of it. Rehab is where a person does go to get more help, but recovery is about making good decisions, abstaining from substances of choice, by learning new behaviors associated with healthy recovery, dealing with stressors, vocalizing my issues, being open and honest, owning up to the things that I did, making amends to others, recognizing where my weaknesses are, practicing mindfulness, practicing helping others, and balancing everything with recreation and entertainment.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.